Begin in the name of Allah subhanahu wa ta'ala, Lord of the heavens and the earth, our creator, sustainer and nourisher, to whom all praise and glory belongs, and we send our salutations of peace, love and blessings upon the master of mankind, the very best of creation, Muhammad Mustafa, Rasulullah, Habibullah sallallahu alayhi wasallam. Listeners of Ramadan Radio, Assalamu alaikum wa rahmatullahi wa barakatuh. May peace and blessings be upon each and every one of you during this glorious, wonderful, beautiful, blessed, spiritual, glorious month of Ramadan. It is Ramadan 2023 and we are almost coming towards the final stretch. How is your day been? Are you back at work? Are you coming home from work? I know the kids have still got the rest of this week off. And how's that revision going? Are you hitting the books? Are you hitting the laptops? Are you doing all your research? Or are you just sitting there hoping ChatGPT can take the exam for you? If not, then don't worry about it. Don't worry. Keep doing your best. Alhamdulillah. Make lots of dua during these special 10 nights. And inshallah, Allah subhanahu wa ta'ala will give you lots and lots of success. Okay, it is 5:06, which means it is time for a drive time, and we are having another superstar special guest on the program today joining me. So those of you who know me will know that I'm very passionate about LOROS Hospice. It's the place which helps people who are terminally ill or coming towards the end of life live in a comfortable, dignified manner and make sure that the care is as personal as it can be whilst supporting loved ones and their families. Those of you who know me quite well will know that my mother 10 years ago accessed LOROS, and as a result the service and the experience we had changed my life, and it has stuck with me ever since then. And I'm very, very passionate about the organization. In fact, I'm very fond of the organization because it means so much to me, and the wonderful people and the staff that do so much incredible stuff there. And it's not become a mission, but I'm very keen and I'm very aware that our community, the Muslim community, the South Asian Muslim community, needs to have a better understanding of not just end-of-life care, but accessing hospice services when they need to. So they're not care homes, they are special units, special institutes, organizations that are designed to help people manage their long-term condition, but also relieve suffering of the patient, the individual and their family. So that's what we're going to be talking about today. And joining me on the line is Dr. Zoebia Islam, lead research at LOROS Hospice, and wears many, many hats that I don't have the time to mention. But Assalamu alaikum, Zoebia, how are you?
Wa alaikum salam, Irfhan. I'm good, thank you. And thank you so much for having me on your show today.
Absolute pleasure. As you know, you're friends of Ramadan FM, so inshallah, whenever we can get LOROS on to talk about this important work and engage with our community especially, then I think it's really, really important. So first of all, how's your Ramadan going? How's the family?
It's going well. We're over the hurdle now, aren't we? So as you say, the last 10 days are the most significant. So no, alhamdulillah, it's going well, and the family are doing well also.
Good stuff. So I just want you to remind our listeners a bit about what you do at LOROS.
Certainly. So I'm the Deputy Lead for Research at LOROS Hospice. So that's the Leicester, Leicestershire and Rutland Hospice. And I'm also an Honorary Lecturer at the University of Leicester. So myself, I have a background in social psychology, having previously worked in the area of health inequality and inequity and ethnically diverse communities in mental health services. But over the last 10 years, I've been fortunate enough to work at LOROS Hospice, and I've been focusing on exploring inequality and inequity for ethnically diverse communities in palliative care. And most recently, Irfhan, I worked with yourself and colleagues such as Professor Christina Fall on developing and completing a project exploring the barriers and enablers to end-of-life care planning with ethnically diverse terminally ill patients, their family caregivers, and healthcare professionals who support them. And as part of this project, I've really had the privilege and honour of speaking to numerous families, patients, bereaved family carers across Leicestershire, across Nottinghamshire, and asking them about their thoughts and experiences on having end-of-life care planning discussions and the barriers that they face to these, and what's gone well, what's not gone so well. And as part of this project, we've also developed key resources to support NHS healthcare professionals in having end-of-life care planning discussions, and these are available free of charge across England.
Fantastic. And yeah, that was a piece of work that I particularly was very proud of and very honored and privileged to be involved and a part of. So that was an incredible experience for me personally. Now, since then, and I suppose the current project that we want to talk about today has been a bit of an offshoot of that study, but it was really the coronavirus pandemic which acted as a catalyst for this new declaration of faith product. So that's, I think, the current project that you're leading on. Could you please tell us a bit more about the Declaration of Faith project and how it came about?
Certainly. So you're absolutely right, Irfhan. It is a follow-on, if you like, from our findings from the Thinking Ahead project, which is a project yourself was involved with, Irfhan. And so as that part of that project, we know that individuals highlighted, families highlighted that they really want healthcare professionals to know about themselves, their culture, their faith, their beliefs, what's important to them. And it really resonated with a Zulu greeting called Sawubona. And Sawubona literally means I see you, but it's more than just seeing the person. It's about seeing the whole person in terms of what matters to them in terms of their culture, their beliefs. So seeing that whole person. And our work highlighted that people want to be heard by healthcare professionals in terms of what's important to them from a cultural, religious and personal perspective. And it's imperative that we understand what's important to patients and families in terms of their beliefs, what's important to them, to ensure that the care that we provide is personalised and acceptable. And we know that the declaration of faith, the Shahada, is of fundamental importance for Muslims. It's very pleasing to God and felt to be very important to say or hear at the time of illness and dying. And absolutely, COVID has highlighted that many doctors and nurses have had to act as family members when death's approaching, especially because of COVID restrictions. Family members couldn't be present. So it's really important that healthcare professionals understand more about people's culture and religion, what's important to them and their loved ones. And the Declaration of Faith project is exploring why the Declaration of Faith, if it's something that's significant and should be said by healthcare professionals potentially when a patient's family cannot be present. But it's also more about exploring the importance of spirituality and faith and culture for individuals and how healthcare professionals can embrace this.
Okay. So the whole coronavirus pandemic, I know you were personally affected by it, as were so many people. In an instance or in a scenario where someone is approaching end of life, they are completely isolated or alone, they themselves are unable, they might not be conscious, but they are unable to recite the Shahada, the testament of faith, and the family members can't be in there. It places there's a huge, I suppose, I don't want to say, there's a huge importance placed on that healthcare professional to maybe step in on the behalf of the patient or their family to administer this last rite.
Yes, absolutely. So it's exploring really whether this is something that's even acceptable really for the family. Is it appropriate for a healthcare professional to say this? So what happens, we know, at the end of someone's life is really important, and that memory lives with the family, doesn't it, forever? So we want to help people have the best end of life and the best possible memory. So from my own personal experiences, when my granddad died, for example, and this was in the height of COVID-19, COVID restrictions were in place, family couldn't be present, and he died in hospital. But it gave myself and my family great comfort to know that the healthcare professional, the doctor that was with my granddad at the time, was from a Muslim background, and he was able to say the Shahada. But that gave us solace and comfort. But as you rightly say, we don't know whether that's something that all Muslims would view as respectful. And is it adding an additional burden for healthcare professionals to even ask them to do that? Is it appropriate for somebody to say that at all if you're not from the same faith belief? So this is the questions that we're asking in consultations. So when I say consultations, we're approaching Muslim communities across the East Midlands This is not something we're discussing with healthcare professionals, just to highlight that. This is very much a consultation with Muslim communities to see whether this is even an appropriate, something that's appropriate that should even be done. Is it acceptable, with all the diversity that we have in the Muslim community? Because we are all diverse, aren't we, in terms of our cultural beliefs, and that ultimately has an impact on what we may view as being respectful or acceptable to be said during end of life. So we're having these consultations. We've already started having consultations with individuals from the British Islamic Medical Association. We've had discussions with scholars and students at the Martford Institute of Higher Education. And you yourself, Irfhan, have been supporting us in convening some of these consultations within Leicestershire to see firstly whether this is even something that Muslims themselves view as being appropriate and acceptable. So it's asking questions in these consultations. Is this something that's wanted? What are the potential harms? How would we broach the subject with families?
Okay, just taking a step back from there before we discuss the findings of your events, just give our listeners a sense of why this area or topic is so important. Because you touched on some of it there. I mean, and it is obvious, obviously, for any practicing Muslim, the ability to recite the Shahada at the time of death is a main objective before passing on. But aside from that, what other things do you feel are important around this subject?
I think it's not just about the Shahada itself. It's about healthcare professionals being aware about what's important for somebody in terms of their faith, their spiritual beliefs, what's important to them personally. So it's about recognising that, so ensuring that the care that's provided is personalised and acceptable and appropriate for that individual, for that family, if that makes sense.
Yeah, absolutely. And in terms of some of maybe you've heard from some healthcare professionals who are not Muslims. Are they curious about the Shahada? Do they want to be able to make sure things are in place so to enable that patient to have those last rites?
I must point out we've not spoken to healthcare professionals. Right, okay. That's not something that's part of this project, but it may be something that we do following on from this work. The first step is to gauge whether this is something that Muslims themselves view as being important. Is it something that we should even broach, really? So this is the first phase of this work, and then possibly the next step, depending on what we find, we shall go and do that work with healthcare professionals.
Okay, so you mentioned that some consultation events have already taken place. What are the emerging themes that have come out from these?
Okay, so I can certainly draw on some of the preliminary findings from these consultations, because this work's still carrying on, and there's another year to go before we complete all the consultations. So it's really important to highlight that. But, individuals have been very empowered to discuss their views, really, about this subject, and it's something that's viewed as being extremely important for them to discuss. So that's the first finding, is that people are very keen have the opportunity to discuss this subject. So some of the findings, we know that in Islam, preparing for death is a major facet of life. So conversations about death and dying are a common part of life. So the Quran reminds Muslims that indeed we belong to Allah, and indeed to Him we'll return. So the focus of patients and relatives during the final weeks and days is around worship and putting worldly affairs in order. So it is very much around that planning, if you like. And this means a lot of time was spent praying, exploring their relationship with God. But it's also clear from the consultations that we've held that not all British Muslims will practice their faith in the same way. So culturally, different groups will have different attitudes towards death and planning ahead. Also, if somebody has a very positive outlook on life, they may be wanting to receive as much treatment as possible to delay that inevitable outcome of death. So they're constantly striving to have that positive outlook. There's also tensions between theology and culture, or custom and choice, if you like. And we've also spoken to scholars, and scholars have told us that witnessing, that is saying the Shahada, is intensely personal. So the Shahada is a confessional statement in which the person saying it is bearing witness for themselves. Therefore, it's a question whether or not whether or not someone else saying it is even allowed. It's something that you say for yourself. It's portrayed in the stance that you have throughout your life as a Muslim. So, is it even relevant for somebody else saying it? Is it even allowed? And of course, the Shahada, if it's not said accurately in Arabic, this also has issues, as the Arabic has spiritual relevance. So again, it's, highlighting, is it even important for somebody saying that? And also, is it right that somebody should say that if they are not from a Muslim faith, that's not their belief system? So is it even fair for healthcare professionals to be asked to say that? Is it appropriate for them? If they're Muslim, yes, they may have an understanding and, acknowledge that this is important. So there's been anecdotal evidence, for example, people have told us what happens in Muslim countries. So, for example, somebody told us that in Malaysia, anaesthetists are encouraged the patient to say the Shahada before general anaesthetic. In United Arab Emirates, staff who are all Muslims say the Shahada at a death or cardiac arrest, although it's not necessarily said out loud and it's not formalised in a designated role. It is, said, but it's also important to remember that these are predominantly Muslim countries and it's viewed as a humanitarian act to say the Shahada. So, all these things have highlighted the real importance of discussing this topic with Muslim communities.
And in terms of actually approaching this subject, because we know from the previous work, talking about death is not easy. It's complex, it's emotional, it's sensitive. Has there been forthcoming engagement from people you've approached or people that you need to hear from, or are you still finding that, well, I don't want to talk about that, or there seems to be a lack of understanding or awareness of how this might affect them?
I think broaching it with the focus on Shahada has been key in opening the conversation about death and dying in general. So we're focusing on a very, very small part, aren't we? We're just focusing on that, the Shahada, but it's allowing us to engage with underserved communities, communities that don't generally have the opportunity, have a voice, to have their say about this topic. And it's really opening up that doorway, if you like, to having the conversations with our diverse communities. As you know, Leicester is a super diverse city, isn't it? We have a minority majority, so it's really important that we gauge everyone's opinions around this subject. So, it's absolutely been the right way of opening up the conversation about something that's generally viewed very taboo, isn't it, in society, death and dying. But having the conversation around Shahada has really opened up a lot of doors, and it's allowed us to empower communities. They felt empowered enough to speak about this. The Muslim individuals that we've spoken to felt extremely empowered to have a discussion about this topic. It's something that's very important to them. There's been a real sense of delayed grief due to not being able to grieve collectively as a Muslim. And having this discussion, people have highlighted that it's really important to have such discussion so that healthcare professionals are aware of what's important to them when it comes to end of life care and end of life care planning.
Okay. In terms of the stakeholder group or the community or the target group that you want to speak to, are there still any elements or groups that you still need to hear from or who need to lend their voice to this discussion?
I mean, we would be keen to hear from any Muslim community groups, organisations across the East Midlands that would like to be involved in these discussions. We know that there's diversity amongst Muslim communities, Sunnis, Shias. We want to include as many diverse views as we can, so that we're able to get a deeper, fuller understanding of what's important to individuals around this particular topic. So if any of your listeners are members of any community groups or organisations, or simply themselves would want to come along and talk about this topic, please do get in touch with us.
Yeah, absolutely. And they can go on the LOROS website to get details. Is that right?
Well, if they contact you in the first instance, we're happy for them, or either they contact them or us directly as a research team. That would be great. Okay. The research at LOROS, that would be great.
Anyone who knows me, please contact me directly. and I will help facilitate that conversation. Not a problem at all. This
Thank
is
you.
Ramadan Radio. You're listening to Drive Time with me, Brother Irfhan, and I'm in conversation today with Dr. Zoebia Islam, Deputy Lead for Research at the Hospice Education Department. The Education Department is doing some absolutely fantastic things in terms of upskilling and informing healthcare professionals, but also important community engagement work to help make sure that end-of-life care is the best it can possibly be, because it's an important time in everyone's life, and it's a significant time, regardless of what faith you are. So their aim is to make sure that end-of-life care is as personal, is as dignified, and is as complete as it can be as people approach the end of their life. So if you've got a comment or you'd like to drop us a note, why not send us a text on 077 488 55055. I'd really, really, really love to hear from the listeners out there around what they think on end-of-life care planning is and what it should involve, because this is an important aspect of healthcare. Not everyone's experience is great, and we know from the research and the data and anecdotal evidence as well that your end-of-life experience, whether it's a close loved one or someone that is part of your group, it does stay with you. So whether it's a good experience or a bad experience, and the bad experiences tend to linger with you longer. And there is an inconsistency around the end-of-life care experience. So please, 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 I would love to hear from you, and I'd love to hear your thoughts. And let's have a discussion and engage on this subject. So moving on then, Zoebia, the next question is around the Muslim communities and the sense you're getting from them about the importance of this. I know you've touched on it a bit before in your earlier responses, but let's talk a bit more about that in detail.
Okay, so I think I've already said that there's a real sense of recognition of the importance of this topic. Individuals generally want to discuss this. Many of the people that we've spoken to have given examples of both good and bad experiences, particularly during COVID lockdowns when you couldn't be with family members in the hospital when they were dying. And for some individuals, these experiences have highlighted what we already know in terms of inequalities and inequity that's always been present. So what I mean by this is that we know there's a lack of diverse workforce, for example. There's lack of accessible information, and there's often a lack of appropriate provision of interpreters, and the general lack of understanding or awareness of religious and cultural beliefs, and the significance of spiritual, religious, cultural beliefs in terms of having a good death, the importance of this for somebody who, for example, has a strong faith. But there's also a real acknowledgement of the real positive experiences that people have had, and the way that doctors and nurses have tried to make every effort to support the family when the relative is dying, and that's during lockdown and beyond that. And there's also a sense of not wanting to burden NHS doctors and nurses with additional tasks of having to say the Shahada, for example. And there's a sense of wanting to discuss ways forward. So people have said, instead of doctors and nurses having to say this, why are audio recordings not available of the Shahada, for example? Why is there not a Quran cube available so that doctors and nurses don't have this additional task? So it's really important to have these conversations because people are giving us solutions, and unless we have these conversations, we wouldn't know about these things.
Okay. So just remind me again, when does this project finish? You said you've got about a year left?
We've got a year left, so there's plenty of opportunity if anybody wants to get in touch, and we're happy to organise a consultation group with individuals, whether they're part of a community organisation or individuals themselves that want to come forward and discuss this topic.
Okay, great. So as we're talking about faith this afternoon, as we are on most days here on Ramadan Radio, I just wanted to remind listeners of the Leicester Hospital's charity cause this year. They are raising money to create a spiritual care centre, very appropriate in terms of what we're discussing today, at the Leicester Royal Infirmary. And it's going to be a purpose-built space designed for use by staff, patients, and the wider community as a place to reflect and pray, which again is part of the healing process for individuals, loved ones, and their families. So the target is £10,000. Please visit the justgiving.com page Ramadan Radio, that's Ramadan without an H, Ramadan Radio 2023. And please donate whatever you can, because this is a much needed space for every faith group in the city. And it's going to be a safe space for people to use as and when they wish. Right, Zoebia, so I want to know more about what the next steps are for the project and how people can get involved. And that's the important thing. I want people to get involved.
Yeah, absolutely. So we have got a couple of consultation groups set up after Ramadan in Birmingham. So really looking forward to having those discussions. As I said, really important for listeners to call in with their thoughts on this topic if they can, or text in. As you mentioned, you've given a number out, so really would be keen to hear listeners' thoughts about this. If they want to know more about this topic as well, we've also been involved, myself and Professor Christina Fall have done a monthly spotlight podcast with the Markfield Institute of Higher Education, the Centre for the Study of Wellbeing. So please do have a listen to that, and that's a more lengthy discussion of this
called
topic.
Again? Just give me that name again. What's the podcast?
Sorry, it's a monthly spotlight podcast.
Spotlight
with the Markfield Institute of Higher Education.
Okay, great.
Part of the Centre for the Study of Wellbeing.
Mm-hmm. And so, any events taking place locally?
So we haven't got any more consultations set up as yet, but we'll be keen to set further consultations up if anybody gets in touch with us. So happy to work with any community groups going forward.
And are there any particular community groups that we would like to hear from?
It would be great if we could speak to Somali community, just any Muslim communities across Leicestershire that would want to get involved. So, some of our newer communities that are from the Muslim faith would be great as well.
Okay, fantastic. Right, and just remind us again, so once the project is finished, what happens?
So, depending on what we find, then there will potentially be an opportunity to discuss the findings, and feed into policy and practice going forward. We don't certainly want it to have an impact on our own policy and practice if significant findings are telling us. So, for example, as I said, people have told us about, why not having recordings of the Shahada? So that's something we could certainly put in place in our hospice ourselves, or have a Quran keep. So we're learning as we're going along, which is having an impact on our practice and making us more accessible for all our diverse communities. So that's, as we're going along, we can implement those changes. But ultimately, we would like the findings to feed into policy and practice, or lead into future work, which would be the next step, and potentially have discussions with healthcare professionals.
So this is really, I don't want to say tip of the iceberg, but this will allow the organisation to look at other areas where research can be undertaken in order to be part of that thing of just improving end-of-life care for patients. And I know anyone who's been to LOROS will know just how incredible the care given is and how personal it is, because end of the day, this is people looking after people. It's a people industry. And I think sometimes, having worked in the health service myself, that I don't want to say humanity, lack of humanity, but sometimes we lose sight of the person behind the patient. Is that right?
Absolutely. So we all come in, don't we, with our own assumptions, our own stereotypes, if you like, but it's about healthcare professionals recognising those, but also embracing diversity, being able to ask patients, their families, how can I make your end of life care? How can I make your experiences the best they possibly can be for you and your family? So it's about having the confidence to ask those questions, isn't it, in a way that's appropriate and acceptable. And this is, as you say, very much steps towards making our services equitable for all.
Yes. Okay, brilliant. I want to talk a bit more about the hospice itself, and you mentioned at the beginning of the program that you've been there for 10 years now.
Yes,
I'd be really interested to learn about what your experience is, what you've learned, what you've gained from your time at LOROS.
Gosh, it's been amazing, Irfhan, quite honestly. It's been humbling. It's been a privilege to work at the hospice. I had the opportunity to speak to some amazing people through the work that I've undertaken. People have shared their deepest thoughts, experiences, and that's a real privilege, isn't it, for somebody to share that with you.
Entirely.
And it's absolutely, and you're right, we are a people industry, so it's also been amazing to work with some fantastic staff at the hospice, and ultimately our aim is to be the best service we can be for all our diverse communities. So it's been a real privilege and honour to be part of that. I can say that wholeheartedly. The time has flown, Irfhan, to be honest with you, and I've learned so much along the way. This project itself has made me reflect on so many things: my own faith, my own practice, my own beliefs. And I think it's all about learning, isn't it? As you say, we are people-based industry, so we as healthcare professionals are learning as we're going along, and that's so important, isn't it? We're constantly open to learn. So, and I'm always learning, there's so much more work to be done, and these are just tiny steps, aren't they, that we're trying to take to achieve equity for all.
Yeah, and I think for me, having never accessed hospice care services until we had to through my late mother, I still get really frustrated and annoyed and wound up when people make that glaring assumption that a hospice is a care home. Could you just please explain to our listeners what a hospice does? Because I think one of the things in our community, in our culture, and I'm generalizing here, is that we have this responsibility, or this implied responsibility, that it is our duty to look after our parents as they approach old age, or if they're dealing with any long-term condition, and which is quite right. But with that, there seems to be this total stubbornness not to engage or reach out to access support and services, because they think, oh, it's a hospice, it's just a care home, it's like a scrap heap for people.
Right. I think there's a lot of misconceptions or misunderstanding about what a hospice is, and that's certainly something that has come out in the work that I've been undertaking, the work that I undertook with you, Irfhan, and others. And a lot of it is about people don't know what a hospice is. So a hospice is not a care home. It's a free service. You can only access it by referral, so that's generally by a GP, for example, or healthcare professional, and that's if you have a terminal illness, so that's an illness where there is no cure. We have palliative care. We provide palliative care, so it's not a curative treatment that you'll receive, but we have a day therapy unit, so it's not all inpatient. There is inpatient ward as well, but there are services where you can access it as an outpatient as well, so healthcare professionals can come out to you. If it's something about not wanting to come into the hospice, then we can work with the family and provide care within your own home environment, because that's also something that we find people are not often comfortable with. And if you are in the hospice, there's every attempt to make the service as personalised to you, so what matters to you in terms of, for example, being a Muslim, we would make every effort to ensure that those needs are addressed. So, and these are common misconceptions. People just generally don't know what services are available for them on their doorstep, do they? And I think that's why it's so important to do work like this. So not the community's coming to us, but we're actually going into the community so that we've got that dialogue and able to explain what it is that we can provide. So it has to be two-way, doesn't it, Irfhan? So it's really important that we have that dialogue.
Absolutely. I think we are sometimes our own enemy, and we need to be able to empower ourselves to say it's okay to access this, or it's okay, or remove some of that guilt, judgment, stigma, whatever it might be that's holding somebody back from saying, hey, I really need to. So if there is someone listening out there and you are, and you would like to understand more about some of the help and support out there for yourself or a loved one or a member of the family, please contact Ramadan FM, and they will contact me, or you can contact me. I'm on LinkedIn and I'm on Instagram as well. And I also don't mind giving out my personal number. So if there is someone out there who wants to maybe access LOROS or services like LOROS, then give me a call on 078 66 566 730. One thing I need to share with you, Zoebia, is as a result of the work we did previously, someone said to me, and it totally blew me away, said that if it wasn't for that meeting that we held, or that event that we held at the city retreat, it helped shape the end of life care for their loved one. And that event or that meeting was instrumental in shaping that. So I think it's very, very powerful and impactful in terms of how you can absolutely, change the way somebody sees care or gives care. And it's really important because looking after someone with an end-of-life condition or is very, very stressful. And sometimes we tend to forget the person who is the carer. So just tell our listeners a bit about, if someone is a carer right now, what they need to do to make sure that they are well enough to continue looking after their loved one.
So I think as a carer, we often have a lot of carers' guilt, don't we? So carers, the findings from our previous work have highlighted, carers are the ones that are going out to consultations, aren't they, with the patient, and they're having to take time off work. They also need to consider the impact of caring on their own health and mental well-being as well, because it can be really stressful, can't it, being a carer? Your sole focus is the patient, but it's also about recognising the impact of that on yourself. And LOROS is fantastic in the sense that we do provide support for carers. If you are referred to the service, and there is that support for carers as well. There's also respite available as well. So these are all things that are available, but it's a matter of speaking to your GP and finding out what support services are available for you and your family. So taking that step really to do that and not feeling guilty for doing that, because if you're a carer, ultimately you need to be well enough to be a carer, don't you? But it's having an impact on your own health, and
Absolutely.
There's no guilt in asking for support.
How can you give to others if you've got nothing to give to yourself? Really,
exactly.
is the essence of that. So thank you for that. So if there is anyone who would like to understand more about the services that LOROS offers, or if you're struggling, maybe you need a bit of support, someone to listen to you, or some advice, then please get in touch with the radio station, or you can contact me directly. I'd be more than happy to do that. And there have been some people in the past that have done that, so I am here to help and advise if that is what you need. Right, we've got a few minutes left of the program, Zoebia, and I think we've spoken enough about the Declaration of Faith project. So good luck with that. I'm really excited personally to see where we go next with the discussion and what happens. So looking forward to our next steering group meeting, which I think is coming up just after Eid. So that's going to be exciting. Yeah. What other projects are LOROS doing? not you personally, but that you're aware of within the research space.
So we're doing a number of projects specifically exploring inequity and inequality in palliative care. We're just in the process of completing a project in which we've involved young people, where we've asked them why dying matters to them. And this is, again, findings from our previous work, which highlighted that young people are often the ones that are going out accompanying family members to doctor's appointments, but their views are very rarely heard. So we wanted young people to have the opportunity to discuss why dying matters to them. And they've created a fantastic piece of art. So this piece of art has got words, images in about why dying matters to them. And this is something that this piece of art is going to be launched very soon, in the next month or so. So that's a project that we have continued doing now with young people specifically. Another project that we're exploring is around called the Crisis Project, which is exploring individuals who are particularly vulnerable if they were to, for example, have COVID, those individuals with end-stage kidney disease, and whether the COVID pandemic has had an impact on these individuals, the healthcare professionals who support them, readiness or willingness to engage in end-of-life care planning discussions. So that's another project that's starting very soon. So there's a body of work really that we're doing around the issues around palliative care and inequality and equity.
Wow. So I'm just really curious to learn a bit more about the young people piece. What, are you able to share any of the themes, or what were any commonalities that came out from that work?
I think the work highlighted, how important this topic is for young people. They were really keen to talk about this. So we spoke to over 50 young people. We've still got a couple more consultations left to hold with young people. But, they talked about what was important to them, how death and dying may them feel, what was important to them from a cultural perspective, from a faith perspective, but also from a personal perspective. How media influenced their thinking as well. And these are all things that were then incorporated into this wonderful piece of art that they've created. So it's something that I'm very looking forward to seeing. I've not actually seen the finished piece, and nor will I until the launch of that piece. But happy to come and talk more about that in the future, Irfhan.
Absolutely brilliant. I know from me, as my personal experience, when I lost my grandmother and I was only 12 years old, it's something that has stuck with me, and it leaves a big imprint on your heart, your mind, and your whole being. When you experience death for the first time, it's and again, the nature of that, depending on what the conditions or the circumstances are, can be very, very powerful and long lasting. So I'm really pleased to hear that young people are getting involved and lending their voice to these discussions, because I think sometimes they just get overlooked, don't they? Or maybe we get so caught up with our own emotions, we forget the youngsters and the impact that has on them, and how important it is to make sure that they're okay in terms of dealing or processing their emotions, their grief, and what they're going through.
Absolutely. And being part of these consultations has certainly empowered young people. They're not afraid of saying what matters to them. And it's also, again, about opening that door, isn't it, of having that conversation, opening that door about a subject that's generally taboo in society in general. So, no, really pleased to be doing that work with young people.
Great stuff. Fantastic. Well, Zoebia, we're coming to the end of the program now. So I'm going to give the final word to you. So you've got a minute and a half or so to send out your message to our listeners. Over to you.
Well, just to say thank you so much for everyone that's engaged in our work so far, but I'd strongly urge you to get in touch if you want to be part of any of the projects that I've talked about, the Declaration of Faith or any of the other work that we're going to be undertaking. And if you want to know more about LOROS Hospice and the work that we do, please do get in touch.
Yeah, okay, so we've had a message come in. Salams, Brother Irfhan, I hope you're well, Dr. Zoebia. I've been reflecting on this in particular from attending a previous consultation. So this person attended the event not long ago. Whilst I appreciate that this is a much needed discussion, I'm just ruminating as to at which point would healthcare professionals be expected to have this discussion with the patient and the family? When would be the right moment? Of course, being conscious that the family may not be accepting to have that discussion at the critical point in time. Would the patient's health at the time allow them to make conscious decisions? I don't know if you want to comment on that, Zoebia.
I think this is something that depends on the individual circumstances, doesn't it? It's very difficult to say on individual families. So it's something that needs to be done in consultation with the family. And I think that's why it's important to do this work now to find out the answer to that question. But thank you so much for raising that question. And that's something that we can certainly discuss further in our consultations, I think.
Okay, and we had another message coming, so they're coming in quite quickly. That's towards the end of the program.
Oh, okay.
Salams, Dr. Zoebia, a very difficult subject, but a much needed one. Having attended a few of Dr. Zoebia's consultations around death and shahada, it made us realize as a family how important it is to have these discussions on who could be present at the time of death if family cannot be there. We hope that more people in the community get involved with this. Thank you to the medical research team at LOROS Hospice in raising awareness around this. And that's coming from Sister Asma. So there's a lot of appreciation for what you're doing, Zoebia. So long may it continue. So, but no, you just going back to what you were saying as part of your final message.
Just thank you so much, really, for everybody that's given their time to come along to these consultations. But as I say, the door is open. We want to hear from you. We need to hear from you in order to make our services more accessible, more acceptable, more appropriate from you.
Okay, so you heard it there, folks. Get in touch, get involved, participate, contribute. We need your input as we look to improve end-of-life care, not just for Muslims, but for everyone in general. So my thanks to you, Zoebia, as always, for coming on and talking about this important work. I request that you keep us in your du'as, and I wish you and your family a fantastic remainder of Ramadan.
Thank you. And same to you, Irfhan.
So that was Dr. Zoebia Islam, a Deputy Lead Research at LOROS Hospice. I hope you've enjoyed that discussion as much as I have. Food for thought, no doubt. But let us know what you think, inshallah. Get in touch with me on the radio station if you need any access to support or services. Happy to support you. So stay tuned for more Drive Time tomorrow. Tomorrow's guest, I think, is the chef sensation, cooking queen herself, Anisa Karolia, who's coming in to talk about cooking, food, and the launch of her new Ramadan cookbook. So make sure you tune into that. Anisa Grams is going to be live in the studio on Drive Time, 5 p.m. As for me, thank you so much once again for your input, your participation in Drive Time. I love it. I hope you love it. And inshallah, I will speak to you tomorrow. So take care. Remember us in your du'as. Assalamu alaikum wa rahmatullahi